and welcome to our show, Dee Dee Talks, the Art of Specialty Lenses. I'm your host, Dee Dee Reyes. During our adventure, we will explore and discover the tips and tricks of specialty contact lens fitting while introducing you to some beautiful artwork in different mediums from the most talented and artistic contact lens professionals in the business. These mediums could include paint, ink, pencil, calligraphy, photography, and even food. Stay with us as we walk through this museum and paint a picture of how art and specialty contact lens fitting go hand in hand. Our talented guest today is Karen Carrasquillo. Please tell us a little bit about yourself, Karen, and what you consider your most artistic contact lens fitting talent.
My name is Karen Carrasquillo, as you said. I am a native from Puerto Rico. I've been in the mainland for almost 20-some years now. But if you hear a little bit of an accent here and there, you'll know why, as Spanish is my main language. I work at the Boston Foundation for Sight, now known as Boston Sight, and I've been doing specialty lenses. It's been at the heart of what I've done for a good 15 years now. And so you asked me what is one of the more artistic side of contact lens fitting. Is that what you asked?
Yes. What do you feel like your specialty talent? Thank you.
I think that one of the things that I've evolved over the years and try to perfect is the art of fenestrating scleral lenses. When we fenestrate these lenses, especially when we do optic fenestrations, we end up having usually large bubbles around the periphery that can have some complications of Dellin formation, and at night these patients may experience glare. So this is where the art starts to come in. You start to wonder, what can I do to make this fitting properties a little better so that patients are more comfortable and while able to wear these lenses. And early on, around 2009, I started to play with the optic portion of scleral lenses and started to do multiple base curve manipulations. And in doing so, what we're really aiming to do is really change the clearance in the periphery in the different meridians. At the time, we're already able to customize the haptic portions in quadrant-specific manner. So I thought, why not the optic portion as well? And for that, we would use the base curve. And so there you start to put the art, because you start to play with different parameter endpoints and see what's the endpoint. Is the bubble now smaller? Is it down to the inferior corner, or wherever you wanted to place that bubble, right? And so that is something that I've enjoyed, evolved over the years, and I still continue to do. And the most important thing is that by adding a little bit of art into this science of specialty lens fitting, you know, we're really helping our patients for them to be able to continue to wear these lenses, because oftentimes the patients that need the fenestrated lenses are corneas, patients that have corneas that are compromised, you know, for example, like old grafts, right, is one example. And so we can allow them to wear these lenses, but then in a way that is a little bit more physiologic as well.
Fantastic. So another couple of questions. What advice would you give to a new fitter on why to use scleral lenses?
So definitely why scleral lenses. Scleral lenses is one of the most rewarding things that I have experienced in this field of specialty lens fittings. They have wonderful therapeutic properties. And they can really impact someone's lives, you know, change lives, literally, sometimes even as immediate as when you apply these lenses during a consultation. Sometimes these patients come with such an extreme amounts of pain and photophobia that the moment that you apply these lenses, sometimes they cry, but out of happiness, because they no longer feel the pain. So they're truly transformative. And so, you know, you see taglines, you know, transforming lives or reclaiming lives, and it truly goes beyond a tagline. It's a reality. And so to a younger fitter, I would say these lenses do have a wonderful impact in patients' lives. So, and then extremely rewarding. So I would definitely encourage them to embark on this journey.
Fantastic. And I see that in my clinic as well. When I was in clinic, you really do change people's lives with scleral lenses. Absolutely.
Yes.
So what advice, if you could go back to your younger self, what advice would you give yourself on scleral lens fitting?
So two things come to mind, although there's various things that obviously I could tell myself, but one thing would be to avoid having a hyper focus on the lens fit. It's something that I eventually learned to do, but it did take me some time. And take step back, right? And keep the clinical training in mind, because oftentimes when we're troubleshooting these complex corneal disease patients, the complications really go beyond the mechanics of the lens fitting. That's something actually is a lecture that I shared at the GPLI recently. And so now I talk about it with the goal, right? But that's kind of a hindsight 2020. The goal to teach others and to pass it forward. What I learned eventually, but I wish that when I started to do this, I would have done this myself. So definitely I would say that to my younger self, and also to cherish and value what so many of our professors would tell us in optometry school, and that is that a good case history goes a long way when we're managing our patients, and to develop the art of listening, right? Which is another type of art. Absolutely. Because oftentimes just by taking the time to listen to what your patient is saying and not just disregard just with a common teeth complaint, you can really hone in into what the issue might be and really come up with that differential diagnosis, or what the potential reasons for the complications that your patient is presenting with. So truly value case histories and pay much more closer attention to those.
Right, and learning how to dig a little deeper to
Absolutely.
asking the right questions.
Yeah. Oh my goodness. That's another art, right? There's this art of listening and the art of asking the right questions. So, and that's something that we actually teach our fellows. You know, these are things that are intangible, that it's hard to necessarily teach, and something that can develop. But we would hope that younger students learn that craft, to master that craft also early on, for sure.
And it really is a craft at times when you're talking to patients, and we talk about, you know, I know that English is your second language. So yes. Sometimes it's the patient speaking in different terms or in a different language than what the practitioner is speaking. So being able to get back on that same plane of conversation.
Absolutely. And for me also to not be lost in translation, right?
Right.
So it goes both ways. Absolutely.
Perfect. All right, beautiful. So how do you feel your artistic talent has helped you in fitting scleral lenses?
So for me, you know, I do calligraphy. I started, you know, initially as a hobby, and then also as a way to gather some income while I was in high school. And so calligraphy, if we think about it, is, you know, how we put together this letters and put them together into words, but in a way that it has a flow, it has a harmony with the different curves, etc. If we think about it and we try to make an analogy to scleral lens fitting, for example, what are we doing really? We're trying to really conform, you know, take a set of parameters and really conform the ocular surface of our patients, and to have the ability to customize these lenses and power through these spline functions. Really, it's a lot of art that goes into that. And so I think calligraphy and maneuvering spline functions in a way is actually very similar, because you're trying to conform to particular curves and shapes, right? So to me, I think it's very similar. And it also gives you this additional set of eyes that, you know, you want to really find that beauty in what you're doing. And with that, I mean, is beyond a wide eye or a quiet eye, or, you know, just a line haptics on the conjunctiva, but ultimately have an adequate physiological endpoint for our patients.
Absolutely. You're almost sculpting that contact lens to fit the patient's eye.
Absolutely. Absolutely.
Fantastic.
Yeah.
All right. And I do know that you're a bit of an artist yourself as a calligrapher, and we do have some artwork that we're going to show that you've done. How did you get involved in calligraphy? And how do you feel that it helps you in all your aspects?
So I got into calligraphy just as a way originally to get a little bit of income while I was in high school, as I mentioned earlier. Usually it starts with your own network at home, and what opportunities you may start to get as your early jobs early on when I was 14 at the time. And my parents, they're both educators. So especially through my mom's connection, she was an elementary school teacher for 35 years. So I knew early on, through conversations with them that, at the end of the year, the graduating classes, they needed a calligrapher to do their diplomas. And, they would pay well. And this is something that I could do in my own time and at home. And that was a good way for me to gather some income. And I thought that would be perfect for me because I'm a doodler. I like to, even my signature, it took, I always, try to make it pretty and until I get what I wanted. So it's something that I thought this could be for me. And it's truly something that I enjoyed throughout the years. I use it as a way of getting some money while I was in high school and through college. And to this day is a way of, it's like a release. It's a hobby for me now.
Right. Fantastic. And it's interesting because I'm a doodler as well. So I wonder how many contact lens professionals actually do doodle.
Who knows, right?
Yeah, that'd be an interesting thing to find out.
I know, for sure.
All right, fantastic. All right, Karen, thank you so much for attending today. We've enjoyed you so much. Thank you for all your information. And we really do appreciate you being on the show.
Didi, thank you. It's been an immense pleasure to be with you in your podcast. And I wish you all the success. Thank you.
Thank you very much. Thanks, Karen. I'd like to say a big thank you to our viewers and to ABB Optical Group for their support. Please stay tuned for future episodes where we sculpt together art and specialty lenses.